My name is Dr. Ian Hersh. I'm a foot and ankle surgeon. I've been in practice for 12 years, and one of my focuses is in wound care. A chronic wound is really defined as anything that's been there for more than 30 days, but we treat all types of wounds. The main ones that I see in my practice are diabetic wounds, venous wounds where there's a lot of swelling in someone's leg and they develop one. We have traumatic wounds, and we also have wounds that are surgically created, or someone had skin surgery, they might end up with a chronic wound. There's a lot of reasons why wounds fail to heal. One of the main things is a lot of times people haven't undergone proper debridements of the wound. So we actually want to clean these wounds up. We want to take off any of the bad tissue, and that'll give you an opportunity for, whether it's a topical or a skin graft, whatever product you're using, will actually give an opportunity to heal. Sometimes it's infection related, sometimes it's blood flow related. So it's kind of my job to figure out, why is your wound not getting better? I think the biggest thing on the prevention side is really on the diabetic side, and that's controlling blood sugar, wearing proper shoe wear. And then when you do develop a small nick or a blister or just a teeny wound, to get treatment right away. It's usually those who delay treatment that have the worst outcomes. A lot of times we'll measure the wounds, and when we see the measurements are not improving, that's a major sign that something's wrong, and maybe there could be increased drainage, there could be increased redness, there might be increase in pain. And a lot of these wounds are really difficult. They might be on the bottom of someone's foot. So until we make some life changes, a lot of times these wounds will not get better. Anytime you have a wound, really, unless this is just a little scrape, something that is going to get better in a few days, you should get it looked at. I would say, unless you're pretty confident that you have it under control, you should at least see somebody, some type of specialist to get it evaluated. So there's a lot of different treatment options for wounds, and there's not one right or wrong. We kind of tailor it to the wound itself. I kind of think of local wound care as a chess match, and you're really trying to stay one step ahead of the wound. So almost all wounds should be debrided at some point, meaning removing any of the not so healthy tissue so we can get down to kind of good bleeding tissue. We have a lot of different topicals, whether they're antibiotic ointments, whether they're what's called enzymatic debriders that actually kind of eat away the bad tissue, wound vacuums, and then we do a lot of skin grafts as well. So all of those can be used, and sometimes we start with one and within a few weeks switch to another treatment. So when somebody sees me, they always get pretty firm instructions on this is what you should and shouldn't be doing with a wound, on at-home treatments. Is it something you should be letting air? Is it something that should be covered? Should you be changing it every day? Should you be changing it every 2 days? So depending on what topical is put on there, or if it's a skin graft, the treatment at home really varies. So another good reason why you should see somebody and not just go and slap triple antibiotic on it for a month and wonder why it's not getting better. So if you do have a wound and you need to be treated, I'm at Seaview Orthopaedics in 4 of the 6 offices, and they include Homedale, Freehold, Ocean, and Monroe. And I'm almost there every single week at these offices, so we can always get you in pretty quickly, especially for wounds. We won't make you wait, and we'll get you great treatment, and the goal is always to get 100% healing before we let you go.